Welcome to The Real Heal, a show featuring real, raw, and authentic conversations between experts in the holistic health space. I am your host, Dr. Renee Wallenstein, also known as the Libidoologist, double board certified doc, entrepreneur, as well as healthcare disruptor. So if you're ready, let's get into it. I am so excited to welcome the one and only Dr. Erin Ellis to the show. Welcome.
I love that. Thank you. One and only. That's great.
So you're
know.
unique. You're the one and only. And I'm really excited because we're going to take we've talked a lot on my show, hormones and balancing hormones, but we're going to kind of get a little more specific and talk about periods, menstrual issues and such. But before we get into that, why don't we talk about who you are and how you got doing what you're doing today?
Yeah. So I am a naturopathic doctor. My practice is in Gilbert, Arizona. And I actually graduated I think it's right around this time. I think it might've been the 23rd or 25th. I don't know, somewhere 5 years ago, I graduated from medical school. So I've been in practice since, and I started off at a naturopathic urgent care, really seeing everything from kiddos to geriatrics to emergent to non-emergent conditions, and really found my passion for helping women and their hormones. But how did I become a doctor? I actually had a cancer diagnosis 12 and a half years ago. That really changed my, beliefs, or really knowledge around medicine and health, and things that I was just really naive about. I didn't know, that you really needed to drink water. I didn't know that vegetables were really important, or all of these things, because they don't really teach you that when you grow up. And so when I was handed this cancer diagnosis 12 years ago, it literally changed my life. And I learned so much about health and wellness, and then had met a naturopathic doctor, and I didn't want her to stop talking about what she did. I was like, what? There's an alternative way to medicine. Like, there's a way that we can heal the body and prevent disease and really help you become your best version without taking medication. And so come to find out, there was a school, because there's only about 7 or 8 naturopathic medical schools in the US and Canada. And so they're not in every city, like medical schools or, DO or PA schools or anything like that. They're very few and far between. And there happened to be one about 15 minutes from where I was living at the time. And I said, no way, this is like a sign from above that I need to do this. And so I had my undergrad started out as pre-med. I really wanted to do something medical, but then also realized that I didn't want to be in school for the rest of my life. So I gave up on those dreams and got a degree in business, and worked in the restaurants and bars and up until this cancer diagnosis. But I was always kind of lost, and knew that I wanted to do more and didn't want to serve and be a bartender for the rest of my life, even though that was great. Like, it really taught me a lot about people and communication and things like that. So I use that with my, doctorate now. But anyways, when I had all of these classes pre-med, when I went to University of Arizona, and they actually transferred most of them. And this was, at least 12 years that I had not been in school. And I only had to take a couple classes to get in or to be accepted. And I did, and then started medical school in 2013 and graduated 2017. And here I am. So I love helping women with their hormones, specifically their periods, because holy cow, women are suffering with their menstrual health, and it's been normalized. And I don't think that it's fair, and women do not need to suffer, every single month of the year, and it can be fixed. And we just need to figure out what's going on, and then we can fix it from there.
I love that. You're right. There's so many things in health period that are normalized, right? But especially with women's health. So we're going to get into that. But you said something, and I had no idea there were naturopathic urgent cares.
So yes, there's only one in Arizona. It was brilliant. And I send people there all the time. And I loved working there. I think it's an incredible establishment. Her goal was to, franchise it and make it into more locations. So I don't know if she's still planning on doing that, but yeah, it's awesome.
It just seems counterintuitive. You think of urgent care, you think of someone going there with an injury that needs, or like needs medicine, right? Like needs a pill, or so like to think of a naturopathic approach in the urgent care setting, it just doesn't seem it seems counterintuitive, but I'm sure,
Right.
I mean, wow.
Yeah. Well, we had medications and we had all of that, for those things that really need it. Cause there is a time and a place for
Yeah,
prescription
exactly.
medication. And we would have that, and we would have the quick, the emergency room was across the street. So we would definitely send people over there if it was something that we couldn't, handle. But, acute viral stuff, I know that they were crazy busy during the pandemic, with IV therapy and ozone therapy and saunas and breathing treatments and all of these things that can, completely help, the symptoms and stuff. And it's all natural.
I love that. And the person coming there knows there's going to be a different approach, which I love even
Yes.
more, right? Than going to a regular urgent care, which you get a lot of people that want our approaches, but have to go to the regular urgent care
Right.
because that's all that's available. So
For sure.
I love that.
Yeah.
So you help women balance hormones, fix their crappy periods, regain their energy. But like you were saying, like everything's been normalized. So how
Mhm.
exactly would a woman know that she has imbalanced hormones? What are some of the symptoms?
Well, it could be anything from I can't get out of bed to I am a moody biatch to I have all these cravings. I am gaining weight. I can't lose weight. My hair's falling out. My periods are atrocious. I'm having to change. And that's where, when I say periods are atrocious, I've learned that women think that that is normal because it's normal for them. And then until we point out the abnormalities with the menstrual cycles, like debilitating cramps, if you are having to take fistfuls of Tylenol or ibuprofen every single month, like that is not normal. Your cramps should be tolerable. If you're having to change your tampon and wearing a super plus and maybe wearing a tampad where you're wearing a tampon and a pad because you're afraid you're going to leak, like that is not normal. Heavy flow is not normal. If you're literally having to call out of work or afraid to go to school because of your period, that is not normal. So anything that's disrupting your life or providing you a symptom that's outside of quote unquote normal and you don't think it should be there, this is a sign that something's going on in your body that we need to figure out what that root cause is, and we can heal from it. But we have to first figure out what it is.
Mhm. Which leads me back to my next question. Where do we even start? Like a woman comes to you, says, well, I thought this was normal. I thought it was my rite of passage as a woman to have
Yeah.
these heavy periods where I'm soaking through, a pad an hour, cramping, debilitated, nauseous, can't go to work. Like
Mhm.
I thought this was the rest of my life. Where do you begin with her?
So my go-to always is labs. Your blood does not lie. I don't like to guess. I like to test.
Mhm.
And your blood is going to tell me everything about what's going on. But we do comprehensive look at it. So I can't tell you how many women have come to my office and have said these symptoms to their regular doctor, and they don't get one hormone tested. It's absolutely ridiculous. Like I just had a patient yesterday with endometriosis, and she had a laparoscopic surgery and she's still in a lot of pain. And I said, well, have you had your hormones tested? She goes, no. I'm like, what? Like, that's the first place I would look is at hormones, and then imaging, if indicated and necessary for that, to see if there's an underlying endometriosis, or maybe they have cysts or fibroids, or, that can indicate PCOS or something of that could be causing the pain or the heavy flow. But
Mhm.
the blood's also going to be very, very, very comprehensive and very informative about the hormones. But they also need to be tested on a specific day of your cycle, which is another um, issue that I see, or, hormones are being tested and they're deemed normal. But to get a really good, accurate picture of your hormones, they need to be tested about 7 to 10 days after ovulation. Now, a lot of women don't even know anything about their cycle, or when they even ovulate, they don't even know what a day one is, or that a normal cycle should be about 28 to 32 days. So we'll educate on that, and then, get some testing to see what's going on with their hormones.
Mhm. Yeah, I have to say, I had two comments. One just flew out, but it flew back in my head. Um, Number one, I was conventionally trained as an OBGYN. So I'm a DO. I went to, regular medical school, DO school, did a allopathic MD residency, practiced OBGYN conventionally for 15 years. The only times I would check hormone levels would usually be an FSH and a progesterone if someone's trying to get pregnant,
Yeah.
or we're checking to see if she's in menopause. That is it.
Yeah.
I have to make a little comment that when I was probably within a couple of years of going into functional medicine, I had several patients I'm in central New York, that would go down to New York City and see a holistic doc or functional medicine. I didn't even know
Mhm.
what that was,
Yeah.
but they would come to me for their exam because they lived in the area, and they say, can you check my hormone levels to save me some money? And I would say, I don't know how to do that. Like,
Mm,
and I was humble enough to admit, like, I don't know what that magic they're doing down there with the
yeah.
hormones. I don't even know these bioidentical. I don't know what those are that you're take these creams. Like I didn't know, but I have to say back in that time, I was a mom of twins working crazy hours. Like I didn't have time to ask questions. I'm just like, your exam is normal. I don't know what tests they want. I'm sorry. Like, I'm sorry you have to
Yeah.
pay for them to do it. But that's just coming from someone who was conventionally trained.
Mhm.
We don't know how to look at hormones outside of, are you ovulating? Can you get pregnant, or are you
Yeah.
menopausal? Seriously, those were the only times that we checked hormones. There was really never a place to check an estradiol ever. Like it was progesterone, FSH. That was pretty
That's
much
so
it.
crazy. But I mean, there's so much more to that. And
I know. And
it
yeah,
boggles my mind, but then it just fires me up. And I'm like, well, this is why I do what I do. And it's
yeah,
just,
yeah.
and I wish there was more, OBs like you at that time that would say, hey, I don't know how to do this, instead of saying, because I've heard anything from,
Mhm.
oh, it doesn't matter,
Uh-huh.
or it doesn't, that's not going to help us. It's like, that's no, it will help. And so be more, honest and open and saying, I don't know how to do that. So,
Yeah.
and then refer.
Yeah. I always credit myself. I give myself a pat in the back for saying that I
Yeah,
didn't have
I
that
love
big,
that.
that big ego, even back then, of saying like, just because I didn't know about it, it didn't exist. Like I didn't know I didn't even know what these doctors were. And I didn't know about these hormones, but I'm like, I don't know about them. So I can't comment. And
Yeah.
I, cause they would say, can you make sure my hormone levels are okay with the medications I'm on? And
Hmm.
now in retrospect, like probably the blood work I would have done anyhow is serum. It probably wouldn't have been a good reflection of the creams, but I know so much more now.
Right.
So that's one. And what was my other? Oh gosh, it came and went. Oh, nope. Oh, yes. Sorry. Um, Speaking of periods, you were so correct. There are so many women I helped get pregnant that were deemed infertile, quote unquote,
Mm-hmm.
that just didn't know when their fertile window was. And so when I
Yeah.
sat there and educated them on their period and their body, boom, the next month they come in, you're like a miracle worker. I'm pregnant. I'm like, no, I just taught you how, like the timing. It's like you miss the boat. It's easy to miss the boat every single month if you don't
Right.
get on that ship in those couple days. So
Oh
super
gosh.
important to educate women at a baseline about their bodies, about their periods, and
Yeah.
what
And
is not normal. Yeah.
it's not taught in school either. Like
Mhm.
even I mean, it's taught in medical school, but it's not taught in elementary or, high school, where I think it needs to be like a class like sex ed, or maybe it is now, but I still don't think it is, because there's so many women that don't know anything about their period. And
Mhm.
then it's also like an elephant in the room. I don't know about you, but when I started my period, my mom was just like, oh, you're going to start, this thing where you're going to bleed out of your vagina, and here's a pad. If it starts, like, let me know. And that was literally all I knew, but I didn't know why this was happening. And then it would happen every month. And so it's actually like a really beautiful process, but so
Yeah.
many women think it's disgusting and gross. And it's so embarrassing. And they're afraid to ask their friends for a tampon or
Mhm.
whatever the case may be. And it shouldn't have to be like that. And then if
Mhm.
you just educate around it and like what's going on, then it's like, oh, okay, I understand. And then also what your hormones are doing throughout our entire menstrual cycle of, a normal 28 days, like you can use your hormones to work for you instead
Mhm.
of against you. And if you know what's going on, then you can understand and be like, oh, okay, I know why I feel like this. I'm in, X part of my cycle. This is
Mhm.
why. Instead of like, oh my God, why am I such a crazy person?
Well, and I love that. And I'm right with you on that, like more empowering women, like knowing what's going on with their body, but also using that information to make, maybe you don't feel so great for this workout today. Maybe don't do that kind of workout at
Yes.
this time of your cycle. Like maybe do something gentle, again, depending on your cycle or the foods that you're craving, and giving yourself
Yep.
grace as far as having a craving and satisfying that craving at that particular time of the month, versus like just hating your body, hating your periods,
Mm-hmm.
hating your hormones. Like I love my hormones and I want to keep them as long as possible.
Yeah.
And
Oh
I work
yeah.
with them. I work with them. So
Yeah, and you totally can. And that's what
mhm.
I'm here to do, is advocate for that and educate. I mean, I recently went viral on TikTok last month for something about menstrual bleeding. And I mean, it just fires me up because so many women were just, I feel like I broke TikTok in the female health industry because they were blown away by what I literally put out there. And I was like, how do women not know this?
Mm-hmm.
Like they didn't know that leaking wasn't normal, and heavy periods and debilitating cramps and wearing diapers and towels. Like, no, this is not okay. Keep
Mm-hmm.
asking questions and don't settle for no as an answer. Like you do not have to suffer. And so many women are, and it just breaks my heart.
Mm-hmm. Yeah, I totally agree. And, before we move on from this topic, and it's kind of going to be period hormone talk the entire time, but like for those conditions that you brought up fibroids and endometriosis, again, from my world, classically, conventionally, they're deemed as surgical, right? Like a woman comes and says, there's nothing you can do for me. I have endometriosis or fibroids. Where do you start with her?
So yes, a lot of them, I mean, surgery might be indicated, especially with endo that's all over the place. Like I'll use that patient I had yesterday as an example, but she's still in pain. She still has a lot going on, and your hormones are influenced by diet, by lifestyle, by toxins, by your gut, by your immune system, your thyroid, your adrenals. So that's where looking at a comprehensive look at you as a whole to figure out if something else is driving, the endo or driving the cysts or driving the fibroids, because there is hope with all of that. PCOS is a big one that a lot of people are like, think they're doomed with, like they have PCOS and they're always going to have PCOS. We can reverse PCOS, but we have to figure out what's going on with you as an individual and then make some changes. It's not going to happen overnight, and you might have a flare, an endo flare or something like that. But then we're like, what happened this last month? Did you fall off the wagon and eat, really, really crappy foods? Maybe you didn't get enough sleep. Maybe you're super stressed. Maybe you were traveling. Like we have to look at all of that. But I don't think surgery is it's never my number one. I want to see what's going on like underlying first to see if we can manage it without having to do surgery. Because sometimes you're better and sometimes you're not. Like this poor patient is still suffering. And she shouldn't have to. And she already had laparoscopic surgery. So, but like cysts or fibroids, if they're big enough, then yeah, they need to be removed. And it, it just depends on the individual. But I would definitely look at hormones in the underlying whole body approach first before we would go, straight to surgery.
I love that. And, here's the reality, endometriosis, you're kind of taught like there's two ways of completely getting rid of it. Take out the ovaries, which, they're estrogen dependent little implants, or go on and this is not always curative, 6 months worth of something that completely suppresses your ovaries and puts you in menopause.
Birth control.
It makes you feel like, or something a little like a GnRH agonist, like it's a little, they literally shut down your ovaries and make you feel like an old lady, give you hot flashes, all the things. And it's like, when you're counseling a patient, and believe me, I've had tons of these conversations, it's like, no, I really don't want that. And like you said, birth control pills, another one, especially continuously used, or Depo-Provera, all these like hormones. But as soon as you go off of them,
it all comes back.
Boom. Like you haven't gotten to the root cause of like why, and it's obviously not sometimes, in my opinion, better to get to the root cause, sort of truck through a little extra discomfort for a few months while you're trying to dig through all the rubble of what's going on to figure out the why. So you don't have to be on birth control pills forevermore, or, these other medications that completely suppress your ovaries, or have that pain, sometimes debilitating, every month. So I think your take on it is it's worth getting to the root cause and the bottom of why you have the endometriosis or the fibroids that are, and like you said, like history of fibroids, okay, get them taken care of, but why? Like come back to like, okay, so I had them, I don't want more, especially if you're late 20s, early 30s, you can get more, like you got many more years of menstruating.
Right.
So
and I've heard every excuse from, oh, you just need to lose weight, or you're, not getting enough sleep. And it's like, don't use that as an excuse. Like, yes, weight can influence your hormones, weight can influence, these conditions and stuff, but that's not the root cause as to why you have them. Your weight might be caused because your thyroid's underactive. Your thyroid influences your hormones and your ovaries. So it's like, we've got to look at the whole body. And I wanted to go back to the birth control and say too, like birth control, as you kind of alluded to, but it literally fixes nothing. It's a Band-Aid effect. And yes, you might feel better, but you can't be on birth control forever. And then we also have all the side effects that come with birth control. Like birth control nowadays is not used for birth control. It's used for
a Band-Aid
period problems and, trying to fix it because, not to slam OBs and stuff, but again, they don't know what to do with your hormones. So they're just going to try and suppress it the only way they know. And that's usually birth control or one of the agonists that antagonists that you were talking about.
Well,
and it frustrates me because I'm like, that's not the answer. Like what happens when you get off of it? Everything's going to come back, if not worse.
Yeah, I agree. And, in defense or not of my OBs, myself included back in the day, like I didn't know, like you said.
You don't know.
And number two, I didn't have the time. Like I didn't have time
True.
to talk to a patient about nutrition or their toxins or, all of the myriad of other things that can be underlying. And I'm like, so there is a huge disservice that's being done in our healthcare system. And, again, many women just go in there they have 5 minutes with their doc. And this was me in the past. You come in looking for a solution to quote unquote solution, right? A Band-Aid to your problem.
Yep.
I give you a birth control pill. You're happy because it does take away your symptoms. I'm happy because I feel like I spent 5 minutes, but you feel like I spent an hour with you because I took away your pain or your heavy period.
You solve the problem.
Until it's time to come off. And it's like, okay, now what do we do?
Yeah.
So we all brace for that period to come back. Like, oh no, she wants to get pregnant. We got to come off our period. And then with that being said, coming off the pill with underlying heavy periods, who knows what was going on? She might not be able to easily get pregnant, which is a conversation that many docs, including myself in the past, didn't have with the patients.
Yeah. So. And a lot of women don't realize that. And it's not to fault of them. And it's not really a fault. I'm not blaming OBs at all either. I'm just saying this is where the disconnect is.
Correct.
And this is where women's healthcare is broken. And why I just keep speaking louder for those, in the back, like keep asking questions. Like you don't have to, if it doesn't feel right for you, then go to someone else. Keep asking questions. Say, I need this. I need this. I need this. Like we really, as women, need to be like crazy advocates for our own health, which sucks. Correct. But that's the only way that you're going to heal is if you keep asking questions or find, the doctor that's going to run everything and explain everything to you rather than, do the Band-Aid. So
Correct. Yeah. And that's what we're speaking to, those that want to just have a little more education and maybe try some things on their own, which totally can be done, right? Like you don't need either of us. Like we're not like rocket scientists. We do have educations and all of our diplomas and certifications and, but there's a lot online. And if someone's empowered enough to take some of this information and run with it and say like, okay, I'm coming off the pill and I'm going to do my due diligence and fix my nutrition and clean up, get my sleep and hydrate and get out the toxins and all the things and anti-inflammatory diet, all the things, then like they'll probably do it. But those that need extra,
and they will feel better. Guaranteed.
And they will feel better. Yeah. That's all you need. Probably a week of doing that. You'll feel you'll feel better on every level and the periods will just follow. Right.
Oh yeah, for sure.
So, let's see. Do you have any favorite supplements to help women with hormones?
It depends on what's going on. DIM is a really good one. DIM, most of my younger women in the teens and 20s that I help with periods, they have a ton of estrogen. And I think it's because of all of the toxins that we have in our environment and the xenoestrogens and these BPAs and pesticides and all of this plastics and stuff that we're exposed to, Wi-Fi, EMFs, like all of it. They have a lot of estrogen. So DIM is one of my favorite ones just to really help metabolize and work on that phase 1, phase 2, or phase 2 liver detox. And usually that's, a higher estrogen is the one that's causing the crappy periods and the cramps and the heavy flow. I love Vitex too. Vitex is really, really helpful for my PCOS patients. In addition to inositol, if they have any insulin, if you're having the weight issue component with PCOS. My endometriosis patient yesterday, I suspect she has PCOS, but she doesn't have the weight component to it. So you can have PCOS and not have, the weight gain and the insulin, the poor insulin control. Liver support is 100% indicated in any hormones, because most women are think of your liver as like a pool filter. It's literally filtering everything you put in your body. So, and it's metabolizing our hormones. So a lot of women are just stuck with their liver. Not that the liver is not working right. It's just working in overtime. So we have to help support the liver metabolism and detox. What other supplements? I love B vitamins and magnesium and fish oil. Probably those are my top 3 for really anyone. B vitamins are helpful for, different conversions in the body. Magnesium is needed. It can help with cramps. It's a natural solution for pain. And then fish oil for fatty acids, protein metabolism, weight management, anti-inflammatory, brain, nails, eye, skin, like you name it. So those are probably my top ones. I'm sure I'm forgetting a big one, but.
And for liver, I love milk thistle.
Yeah.
Okay. Yeah.
Yep.
That's like,
NAC. I've been doing a lot of NAC lately for PCOS too. And that one's, the NAC or N-acetylcysteine is the precursor to glutathione. And glutathione is our body's most potent antioxidant. So most people are burning through and using a lot of their glutathione, especially through the pandemic and, the illness with COVID. We've seen a lot of poor mitochondrial function and liver metabolism and all that. So supporting glutathione pathways with NAC is really helpful.
Yeah. And, just so the listeners know, glutathione is really hard. It's hard to get delivered effectively in your body. And it tastes like
sulfur,
rotten eggs,
rotten eggs.
So like, there's some people I was like, take this or take the precursor and let your body make it. So it's awesome. Yeah.
Or
so
IVs.
Oh yeah.
We do glutathione IVs in the office. Love them. They're so helpful.
Yeah. I live in New York. So there's a lot of things that are regulated here that, speaking even hormones,
stupid rules.
Yeah. New York is one of those states. So 3 years I'll move to a different state.
Right. Yeah.
Count on that. But
in Arizona here, we're fully licensed for naturopathic medicine. So a lot of these therapies they're regulated and okay. So
yeah, I'll come out
live
to
in
Arizona.
AZ, come see me. Yeah.
I might actually. The West Coast is looking very, especially Arizona is looking very, very nice lately. So, I'm sure you're like me. We work with a lot of stressed, overwhelmed women, right? So like we're talking about like balancing hormones. This sounds like a lot to them. Like they're like, oh my gosh, like I'm shutting down already. I can't even think about what I want to do next. So if you were to tell the listener, like, what are 3 things to start to quote, unquote, fix your period, what would they be? Just 3 things.
3 things. Well, if you don't have access to a functional medicine doctor or, a holistic practitioner and naturopathic doctor like myself, which I have to say too, make sure you're going to someone that has credentials to do what they're doing. Make sure that they have clinical experience. There's a lot of practitioners out there that say they know what they're doing, but I don't really, they might not have the credentials to do it. So that's just a little side note. 2, I would make sure your foundations of health are established, because before we can balance anything, we've got to make sure you're sleeping okay. We've got to make sure you have good bowel movements. If you're not pooping daily, that's a big, big thing. We excrete our hormones through our poo. And so if you're not pooping, you're going to be stuck in not being able to excrete that and have an overabundance. And then diet. I think diet plays a giant role. So making sure that we're getting plenty of fiber. Fiber is going to help with your bowel movements. It's going to help with your hormones. It's going to help with weight loss. Everyone in America is getting like 10 to 15 grams of fiber a day. We need upwards of 25 to 30, watching your inflammatory intake. When I say inflammatory, a lot of people are like, what do you mean? Well, dairy, soy, gluten, caffeine, processed foods, alcohol, like those are all inflammatory. Sugar, all inflammatory. So watching the amount of carbs you're having, not that carbs are bad. I love carbs, but mainly carbs from vegetables and beans. So you can get your fiber, help your hormones. So I would first, those are easy things. If you don't have access to a medical professional to do lab work for you, my gold standard and my favorite is to do labs, because then we can find out, specifically what's going on with you. But I would start with sleep, and nutrition.
Excellent. Sleep, nutrition. Number 3. What's the third one? Sleep,
labs.
Nutrition. Labs. If you can.
Yeah.
So in lieu of labs, if you can't get labs.
Let's see. Well, I would start with, or I guess I would look at what's in your environment. How many chemicals are around you? Are you putting chemicals on your skin every day? You can make healthy swaps, one by one. And a good resource for finding out if it's toxic or not is the Environmental Working Group, or ewg.org. They have an app called Think Dirty. So you can scan items that you're using every single day, whether that's detergent to lotion, to your makeup, to your shampoo, foods, things like that you can make, healthy alternative swaps that are low or toxic load that are definitely influencing your hormones.
Love that. And here's a little caveat, like we can't live in a bubble. We get that.
No.
But what women have to understand is that it's our overall body burden, our toxin burden. So when you're putting on one product only, like a personal care product that has 30 ingredients, and you're putting 15 separate products on, each of which have 30 ingredients, half of which are probably what they call endocrine disrupting chemicals, like they're disrupting your hormones, like it adds up. It's a huge burden for your body. And when we're talking about antioxidants like glutathione, they're putting out all the fires. There's only so much it can do. And your liver trying to get rid of all these chemicals, like it gets burdensome for your body. And then your body has to pick and choose what it's going to get rid of. And sometimes it's not the hormones.
Well, yeah. And if you're not pooping, you can't get rid of it anyway. So that, I think that would be my fourth, or is in my top three was pooping, which sounds crazy, but I mean, I talk poop every day with my patients. I'm like, how are your bowel movements? So that if you can't poop, sweat.
Yeah. Perfect. Yeah. And it's interesting when you said poop, like I remember I talk about TikTok, but one of the very first TikToks I did right in the beginning of the pandemic was about pooping. And it was amazing how many people thought it was normal not to poop once, but every 5 days. Like I poop every 5 days. Isn't that normal? I'm like, oh no. So sometimes just raising awareness, like red flag. Yeah. Something's going on, and how can we improve this? So I love social media for just educating and just helping women just be better consumers of information and and their health. And I just want to like piggyback on what you said about in the beginning about quote unquote, you said professionals. I think they're calling themselves experts online now. It's so inundated with people calling themselves experts, and they have zero. And I'm not saying I'm higher than thou just because I have all my training, but I do have training for a reason, and so do you.
Exactly.
So,
and I think it's the clinical experience, like seeing patient and patient after patient after patient. A lot of these experts are just doing it because they healed themselves.
Correct.
Or they went through it, but what did they go through? They went through it with a medical professional usually. Yeah. And now they feel like they're the expert because they went through it, and now they can do it for others. Correct. Which it's unfortunate, but I mean, it is what it is. So that's where, just do your research and make sure that whoever you work with is right for you and is going to be able to help you is really all I care.
I agree. I have over 20 years experience. There's something to be said with working with woman after woman and all the different things. Yeah. And number two, we personalize it, right? There's no cookie cutter.
Sure. Yes.
There's commonalities, but I find that, everyone's different. We embrace that difference, and we tailor your regimen to you. And like you said, when you check labs, like to your I don't want to say abnormalities. I hate it, but to the things that we want to optimize. How's that? There we go.
Yeah. So important.
So important. And, so the last like big question is like, I'm asking you to like pick out one thing. I know it's really hard because everyone, like we just said, is so different, but what is that? Like, what's your biggest tip for women with painful periods?
Oh, my biggest tip is one, you just don't have recognize that it's not normal. And just because it's normal for you does not mean that it's normal. So there is help for it. And I want you to be your own advocate and ask for what you need to figure out what's going on. There's a reason that you have these painful periods. I mean, our life is too short anyways for you to suffer for, a week out of the month. That's 12 weeks. That's 3 months out of the year that you're suffering with period cramps. Like that's not okay. Your period should come and go, and it should be totally tolerable and maybe just a nuisance. Oh shoot, I got to carry tampons around with me. That's literally all it should be. It should be nothing more than that. And you deserve to feel your best. You deserve to do everything that you want to do in the day. And if you're suffering from period pain, like there's something going on. So that's my biggest tip, is to figure out what it is so you don't have to suffer.
I love that. Yeah. Just make it like I just said, I just looked at my next period in July. I'm like, oh, that's going to be a pain to carry tampons in my purse at that, I'll be away. But I'm like, but I'm not worried about pain or debilitating or like leaking through anything or whatever. I'm like, okay, that's annoying, but okay, it is what it is. It's only 3 days. I'm good.
Yeah. Same. I'm going on vacation when my next one's going to start. I'm like, oh, cool. Like, doesn't that always happen? But all right, well, now I know what to plan, but I'm going to be fine. It's going to be all right. Like, again, I'm not going to have to worry about staying in the hotel room because it's going to suck.
Well, and
So I've had women ask me like, can you stop my period for this month because I'm going on vacation? I'm like, oh, sorry, I can't. Like, no, that's not going to fix anything, but let's figure out why you want your period to stop. Like, it shouldn't be that bad.
Yeah. I that was probably one of the most common questions I ever got as an OB, like coming in, like, I'm going on vacation, I'm getting married, I'm having my honeymoon, all the things, like, can you stop my period? Like, and then they stop it for 1 week and they're like, oh, I really like that. Let's like not have a period again. I'm like, and I just want to, something you said earlier, I just kind of want to sort of end on this before I ask you the last concluding question is like, I think so many women are conditioned to think if they have a quote unquote hormone imbalance, that they need hormones to balance the hormones. And I think the biggest thing you said before is like, it's just an imbalance. You probably have adequate of the female hormones, progesterone, but you just have too much estrogen. So if we can figure out how to bring that estrogen down, you don't need extra progesterone. It becomes this like, who came first and chasing after the other? Like, let's chase the high estrogen with getting you more progesterone versus let's bring down your natural estrogen. So you don't, what you have already that you're making is already balanced, right? Is that a
and sometimes progesterone is indicated and but it depends. Everyone's different. So the signs and symptoms of crappy periods can be either too much estrogen and too little progesterone, or too much estrogen, normal progesterone. Like, it could be that. But then again, if you have the low progesterone, we're like, why do you have low progesterone?
Exactly.
Are you not ovulating? Are you burning through it because of stress? Like, are your adrenals in the toilet? Is your thyroid underactive? Like, there's all these, other things that could be going on to cause that. And it's not like, here, take progesterone. It's, why do we not have adequate progesterone? And then again, you might have adequate progesterone, but way too much estrogen. So we work on that. And then why do you have way too much estrogen? So there's a reason. And then we look at lifestyle, we look at diet, we look at liver, we look at poo, we look at all of that stuff to figure out why we have this overabundance of estrogen.
And I love that because it's not an overnight fix either. But when you come to you or myself, like, that, like, if you want the overnight fix, you go get the pill and you put a Band-Aid on it. And hopefully you listen to this podcast, you're like, oh, there's different ways of doing it. So, just know, like, it's worth the work that you put in to figure out the why, because then it's resolved forevermore.
Absolutely.
And not only that, like, you have the toolkit for yourself to utilize in the future.
Yes.
If you start going down that slippery slope of feeling imbalanced again, you know exactly what to do. Right.
Oh yeah, for sure. And you always look and it's like, oh, why did I have such a crappy period this month when I've had like 3 or 4 that are really good? And it's like, well, what happened this last month? Were you more stressed? Did you, overdo it? Did you eat more crappy foods? Like, were you traveling like that? There's usually a reason.
And I think when you're with your patients and my clients, I think what we try to also do is instill this awareness, this presence in your body. So you're even more aware of, like, I think so many women, just like you said, think it's normal, but they're running to the next thing. They're so busy that they don't even know what it feels like in their body. So, like, I think we bring them back to their body to know, like, this is normal. This is not normal. This is what it feels like to feel good.
This
is what it feels like not to feel good. And so when they start, again, going away from that feeling of goodness, like, what changed? And they can tap into themselves and like tweak and get back on track again.
Oh yeah. Yep. Absolutely. Your body best. And that's what, I went through 12 years ago with cancer. It's like, something's not right. Like, I need to get this checked out. And that's where I can't tell you how you feel. I mean, I can just look at your labs and kind of know how you feel based on your symptoms, but your body best. And if something's not right, go get it checked out. Like, again, you never know. I mean, I had cancer, never thought in a million years that would happen to me. Not saying like, if something's wrong with you, you're going to have cancer, but it's just, you need to be the advocate for your own health and really just get it checked out and figure out why you're having that symptom.
Yep. I totally agree. And if you don't like the answer you get, go to a different doctor.
Yes. Keep asking. Like, there's so many women that come to me and I'm literally their last hope, and they're nervous as all hell to come see me because they're afraid that I'm going to say the same thing that they've heard multiple times again. Like, everything's fine. There's nothing wrong with you. It's all in your head. And I'm like, I guarantee I'm not going to tell you that. And then they get so excited when they get their labs and I actually tell them there's something wrong, where they deserve that years ago. They deserve that 4 doctors ago. And it's so frustrating, but it also fires me up. And I love what I do. And same with you. It's like, we help people every day realize that they can heal from their problems, and they can be healthy and they can be happy and they can do all the things they want to do in their life.
Yep. Yeah. It's that validation, especially when you start,
Yes.
like I was one of those patients that you start thinking it's in your head, you know?
Yes.
And I have, like for me, 10 years later, I'm still having this back pain from an injury 10 years ago. And everyone's like, still, like you start thinking like, gosh, am I crazy? Or do you think I'm making this
Right.
up? I just had hip surgery because it was so messed up and it was causing me back pain. I'm like, look
Well, that's
below the
why.
hip. That's why. And I have just one
Yeah.
little comment. My orthopedic surgeon actually had a more holistic side to him. Like, yes, he's a surgeon and
Good.
there was something like that had to be quote unquote fixed,
Mm-hmm.
but like he was actually giving me for pain relief some more holistic approaches. I'm like, oh my gosh, you're a surgeon that's actually looking at the other side of more sustainable, like long term. If you get in this predicament again, this is what you can do to try to offset some discomfort. I'm like,
Right.
so there are docs out there that practice conventionally that have a little edge
Yep.
of like thinking
Find them.
more. Yeah, find them. They're out there. They're not many, but they're out there.
No. Yeah.
I might have the only orthopedic surgeon though, but I don't know. Anyhow, last question. What is something that you know now that you wish you knew 5 or 10 years ago?
Oh gosh. One thing.
I know it's hard.
Yeah.
And
I
it doesn't even
mean,
have to be 5 or 10. Yeah, 5 or 10 would probably be good for you because you went into medical school
yeah,
5
I
years
would
ago.
say that, okay, this is one thing just from being a naturopathic doctor and seeing, things like you do not have to be sick to go to the doctor. I
Mm,
think that is a big myth that we are saying like, oh, I'm healthy. I don't get sick.
mhm.
So I don't need to go to the doctor. I don't need to get lab work done. No, you should go to, I'm not sick, but guess what? I'm doing my labs here next month because I want to make sure that I can be the healthiest version of myself. And if there's anything unbalanced, I want to know. I don't
Mhm.
ever want to go through what I went through 12 years ago again. And I want to make sure that I am living my best, healthiest, and safest life with hormones, thyroid, adrenals, inflammation, blood sugar, cholesterol, all of it.
Mhm.
So I wish that I would have looked at things a lot sooner or really learned more about naturopathic medicine or even knew that it was a thing so
Mhm.
that I could, get ahead of things before it becomes an issue.
Yep.
So that's where, going to the doctor before you become sick is probably something that I wish I would have done and known about years ago.
Love that. And you're referring to being more proactive versus
Yes.
reactive, which is how we are conditioned in our healthcare
Mm-hmm. Mm-hmm.
society. Like you don't go to the doctor if you're sick, if you have an injury,
Yep.
like if you have pain, and otherwise you stay out of the doctor. And maybe yes, maybe that's the case for your regular doc, but like
Yep.
there's other side of medicine is what we do, where it's
Yep.
more proactive. Like you don't want to end up in your doctor's office. So you
Mm-hmm.
maintain your health by making sure that we don't get to that point where you have to be reactive. So I totally love that. Totally love
Yeah.
that.
And I think it's become a little bit more apparent in the last couple of
Mhm.
years
Yep.
with, the pandemic. And it's like, oh, am I healthy? Am I in that high risk? Like people are questioning, like, am I in that high risk
Yep.
category? I don't think so, but I don't really know. So let's go. I've had multiple new patients come in and say, I've never had lab work done. I'm like, what? Well,
Mhm.
let's see what's going on inside you. Like that you might be healthy on the outside, but are you healthy on the inside? We don't know until we look.
I love that. So good. And there was something else I was going to say, but I've never heard that comment before. In all my 130 some episodes, you're the first to say that. So I love that. And I
Oh,
think it's a
good.
it's a great takeaway. It's a great
Well,
takeaway.
remember, I am the one and only.
You are the one and only. I know that. So last thing before we say goodbye, my audience, I'm sure is like are already raving fans of the one and only. And where can they find you? Where can they connect with you? How do you work with people? Tell
Yeah,
us everything.
so I'm only licensed in the state of Arizona for doctor and medical care. However, I can consult, more education and wellness consultant, anywhere. So all of my information is on my website at hopenaturalhealth.com. Super, super active on social media, Instagram, Facebook, TikTok. I also have a podcast too, with which you have been on. And you can find, all that information on the website.
I love it. I love it. Thank you so much. I appreciate you. This was a really fun conversation. And,
Yes.
we talk about hormones a lot, but not specifically periods, which I think is a huge pain point for women. So thank you so
Mhm.
much for sharing all your expertise and knowledge. And I hope you have an amazing day. And I
Thank
hope my
you.
entire audience connects with you.
Thank you so much for having me. It's been so fun.
Well, I hope you enjoyed this episode of The Real Heal and that you learned something new. And before you go, can you do me a quick favor? Take a screenshot right now and share it to Instagram and tag me so I can celebrate you for taking action and improving your health. And if you're enjoying this podcast, please take a minute to leave me a rating and a quick review. This will help others just like you find the show. And do not forget to subscribe because you will not want to miss out on any of the amazing guest experts that I have coming up very soon. And remember, it's not selfish to take care of yourself. Do one thing today that makes you happy and learn to love life again. And with that, I'm out of here. Talk to you again soon.